on same plate. Go on, Dr. Saeed. Thank you.
So that's what was about the retro access sheet. Any question maybe, Majid, about these accessories access sheet with sanction bendable? Any question, or you want me?
Yeah, actually, the just say that the setting of suction still its dilemma, as you said, is according to surgery preference. But it's really I like that depending the size of the access sheath. If you have 10 to
True,
12 sheath,
true,
it's not like
true,
when you have
true,
12 to 15.
true,
So this is
true.
very important. And
And
one thing that we should observe, we should, even if we are not follow any reading or any expert setting, we should see the collapse of the system. If the system is collapsed, so we are in high pressure, so we should
true,
decrease it less.
true.
Thank you, Dr.
And
Said.
and Majid, it's very important to know that the kidneys of the children is that like the kidney of the adults. And moreover, we have the hydronephrotic kidneys, not like the native kidney or the virgin kidney. So it depends on the surgeon preference. We are waiting for that machine to know or to tell us the flow and the pressure and how much suction you can control it. It is available now, but it's still immature. We don't know yet, but it works. It works until now. The experience and the suction and the surgeon will find out his preferred setting.
And now we are in the beginning of era of suction sheets and fans, so we're still working on a lot of access to get the most perfect answers.
True, true.
Okay, go on, Dr. Said.
No, the second part is very important, that most of the company shifted to the small scope. 7.5 is the ideal size for every patient, that I believe that it could be, it could tackle more difficult cases. We remember that with the 9 French, we have the failure of accessing the ureters about 7 to 10%. With the 7.5, maybe you could reach 1 to 2% of access failure, which is very important, very, very important, because it will relieve us from the pre-stenting. Before, we used to pre-stent. Why? Because we used to have an access sheet 10, 12, 11, 13, or 12, 14, and we used to have this big ureteroscope, especially at the first generation of the disposable ureteroscope, where we Boston Scientific, Fusion at the 9 French, 9.2, 9.5. Now 7.5 is the king now, is the size. Now, most of the company wants to go further smaller. The problem, when you go further smaller, you will have more breakage. The idea of getting smaller is the size, not the image. However, certain companies led the world to keep the image as perfect as it's possible. You know, when you get smaller, you get small fibers, you get less light. But look at this. This is the same stone by both scope. Have you noticed any difference between the two illumination? Maybe the 8.7 a little bit better, but honestly, I find it amazing that you can reduce the size to 7.5 and keep the image as the same. We know that if you reduce the size, you will sacrifice the image. Any question, Majid?
Dr. Said, did you think that the images quality it's depend on processor or the size of ureteroscopy? I think
I
with
believe it.
processor
I
maybe
believe it depends. It depends on the CMOS and the size of ureteroscope. If you go to the scopes like other companies, 6.3, 7.5, and compare it to the 9 French, you will find the 9 French much better. Always the bigger is much better because of the light transmission, because the CMOS. Now with the technology like the iPhone, like the Samsung, when you go smaller, you can improve it. It depends on the engineer. Before, we found it very difficult, but nowadays I think engineers could do much better. Look at this 7.5, 8.7. It's the same quality. The CMOS is important, but the size is not any more important.
I saw it is the same quality. I don't think there is any effect of quality for 7.5. Almost the same.
True. That's why we will improve. The problem with the technology will improve every time. It's very fast, so you cannot even afford it. And now, advantage of this scope 7.5. Look, before we used to stent patients and do impacted stone in a very careful way. Now with this 7.5, you can, you know, what is the double G stent you insert for your patient? 6 French, 7 French, Majid?
Almost 6 French.
Yeah.
Almost
So
6 French.
if you put instead of putting a stent and prepare the ureter, what about putting a scope 7.5 or putting a scope less than that? See, it solved the problem of pre-stinking, and the patient has two problems. Patient will be lost, and patient will come with the encrusted double G stent, or the patient will curse you because you put a stent inside him, and we come to the problem of the discomfort of the double G stent. So we will solve all problem instead of pre-stenting and removing the stone, packed stone. Then you put a stent. So we save 3 operation in 2 operation. You imagine what we have done with the small scopes.
And
Shorten the
I think also with, as you said, with the king of laser, TFL is a king, as you said always. So with TFL, we need
true,
small scope to free the stone with one sitting and
true,
discharge the patient safely to his home
true,
without any
true.
without any symptoms.
True. That's the beauty of the, I call it dusting laser fiber because I don't want other companies to blame me. Oh, we are like the others. They said we are dusting. But TFL has a unique low peak power, about 500, which gives you a dust. And the other thing, it does not have a retrobulging. Look at the stone. It doesn't move. So there is no fear that the stone will go to the kidney, except when one thing is the high flow. If you flow the inside the ureter, of course the stone will go out. And even for big stone, look at this. If we associate the 7.5 endoscope with a FAS, we call it ureteral access treated with suction, you can even do much better. It's not only Majed, the TFL or the dusting laser laser fiber, and the stone does not move, is even with the section, means you are holding the stone by 2 things: by the low peak power, low retrobulging, and by the suctioning. Look at this 2 centimeter stone in the upper ureter, and you can have all the fragments come to you with no problem, and the stone not going to the kidney, and you follow the stone. So this is another advantage of a smaller scopes with the uteral access sheet with suction in the big stones. And
Actually,
I
nice,
think
Dr. Saeed. You answered one of audience, Dr. Mishari Zahrani. Just he asked about 7.5 French. Is it useful in cases of impacted ureteric stone? So already you got the slide before I asked you.
true,
Thank you.
true. It is very important because it gives you the idea to, it will at least it will reduce the failure access of the ureter for this stone. For example, if you have the imagined 6 millimeter stone in the upper ureter, and you say, okay, I'll put a stent. No, you take a 7.5 and you go to the stone and you destroy it, and you put a stent. You tell your patient, come and remove your stent. And instead of putting the stent, and you said, okay, come again, I will remove the stent, but this sort of impaction and blah blah blah. So it saves the surgeon, it saves the patient as well.
Dr. Saeed, just I recommend for everybody here, audience, to follow. I think 100% from the audience follow Dr. Saeed on the LinkedIn and Facebook and Twitter also. But he has a lot of real picture from the practice that show the uh, bad side or dark side of RIRS complication. Did you think that there is any difference between the complication that arise from small scope and bigger scope? I mean, can we blame the bigger scope, the 9 French
That's
scope, or
that's a good point. That's an excellent point. I see that the size, yes, it does matter. The size, even for the PCNL, once you go bigger, you have more bleeding. So for the once you go for a scope 9 French, it's not like 7 French. But again, I say that these are tools. We cannot blame tools. We blame the guy who's driving the tools. If you are driving 7.5, you could do injuries more than a wise surgeon who driving 9 French. So it's not only about the size of the tool, yeah, Majid. It's about how do you deploy these tools inside the breeder practice. Now, the size come to you not to reduce your complication. It came to you to help you to reduce the failure of access, to improve your outcome. But you have to know when you stop. And the idea here that if you have even a 7.5, it does not allow you to go inside the ureter. Please stent the ureter. It doesn't mean no, 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 I have to go. Saeed, he said 7.5 goes inside any ureter. No, no, please. It depends on the subjective force that you apply as a surgeon. Some surgeons, they don't they don't realize how much pressure being applied on them by the family or the patient himself. So he said, I will get rid of the stone because the patient expecting from me much better